Hello, everyone, and welcome back to Rehealth here in Cancun. Today, I'm fortunate to be joined by Johnjay. So welcome to our facility here.
Thank you. I love this facility.
So thanks for coming by. So before we get into what you had done while you were here, give us a little bit about your health journey. I know you're a super passionate guy. You've had the vision. I mean, you've been doing cold plunges for fit before anyone knew what the hell a cold plunge was. So tell us a little bit about your health journey.
So I am a father of three boys.
Mm-hmm.
My mother's from Mexico, my father's from the Netherlands. And my dad died of a massive heart attack at the age of 66, extremely healthy. And I couldn't believe it. The guy worked out, exercised, ran on the beach every day. And at that time when he died, I got checked. And my three boys were so young and little, and I was 100 pounds heavier than I am now. And I remember I was laying on the ground and my kids I was so lazy, my kids would just play on me. Right? So I move them around. I was like, I gotta do something. And so I started doing yoga. I started exercising, I started eating right. And I lost 110 pounds. And then since then, I monitor my heart to make sure I don't have the same thing that my father has. And he obviously had cardiac disease. So we find out that I do have cardiac disease. My calcium score keeps going up and up and up. And I had high blood pressure and I had the high cholesterols and everything. So I've started exploring my health and trying to do everything I possibly can. I lift weights, I exercise, I try to eat right. And then I discovered this miracle fountain of youth health gem, right?
Well, yeah, and it's interesting. I mean, obviously the diagnostic tools are significantly better than they were when your dad passed away, right? And we continue to push the envelope because diagnostics.
I want to interrupt you for a second. I said to my wife the other day, every time we come here, I go, can you imagine what we could have done if I knew about this place when my dad was alive? You know what I mean? Yeah. Like it's unbelievable. Like, but anyway, go ahead. Sorry.
No. That's exactly. And everyone has like their own personal reason for coming by. Sometimes it's a hard stop. So a health event that leads you to looking for additional options. Correct. So tell us a little bit about what you had done here at Rehealth.
I think I'm on my fourth visit. I've had 3 stem cell infusions, and then I did NK the last time about 3 to 6 months ago. And I just feel like I operate at a different level than anybody. When I'm in a room with people, I just feel like, even like last night, all of us were at dinner, and I just felt so great. And I don't know how to explain that, but
other than the knee, a little sore, right?
Yeah, my knee's a little sore. But I do a radio show, and for 25, 30 years, I was getting 4 hours of sleep, right, every night. So I don't operate on a lot of sleep, and I feel fantastic now. So I can't imagine what I would really be like without the help of Rehealth. Right. You know what I mean?
And I think that's an interesting point, because sometimes people say, hey, I feel great, but they get used to feeling average. Right. And they think that that's great, but not until you reset or break through that and you get to a new level, you say, no, now I'm really great. And that's what I think everyone gets so kind of used to, a subpar feeling. And it's good to see that you've broken through that and you're at another level now where you can recognize the difference.
Yeah, I totally feel that exact same thing. Like it's just a whole different vibe of excellence. You know what I mean? Totally. And this guy saved my life. This guy's saving my life. Right?
He's the brainchild behind.
Oh my God, it's unbelievable.
So that's a good point to talk about. So why did you decide on Rehealth?
So my doctor. So I started going to see this doctor. She's amazing, Dr. Carrie Bordinko. Well, I've heard about this kind of stem cells. Now, I'm not educated enough to have the conversation of the difference of stem cells, but I've heard about these type of stem cells, different than what's in the United States. And I've researched it, and I've heard several celebrities and people that I respect talk about this type of stem cell. And then one day I'll go to my doctor, and she's having a meeting. She goes, we're having a little meeting about stem cells tonight. And I go, oh yeah, I've had that before, PRP and whatever. She's like, no, this is different. And I was like, different like how? And she explained to me, I go, oh my God, that's I know about this, but I don't know enough. Right. I don't know, like even talking to you guys, I don't know the words, right? But it's stem cells to dumb it down as much as I understand it, these stem cells, they don't know what they are yet. So they go into your body and they make it happen. They fix things. So I went to that meeting that night, and I met this incredible man who'd been here a few times, and he had been to Colombia, and he'd been to the Caymans, and he'd been to the Dominican Republic to get stem cells. And he said, Rehealth in Cancun is the best. He said, I've been to all these clinics, and Rehealth is the best. And I was like, I'm in. And I've never looked back. And what's funny is, I tell Raphael, I do a radio show, and ever since I talk about you guys, all these other stem cell clinics are coming to me saying, we want to bring you to Panama, and I'm like, sorry, man, I got my guys.
That's awesome. So tell us about how your experience has been and the team.
If you could describe first class here, you guys are up here. I mean, from getting picked up at the airport to being dropped off at this great hotel and being picked up at the hotel and dropped here, and then coming in and seeing Lucia's warm face waiting for you when you pull up. You walk into this great staff. Everybody's so friendly. I mean, it is the Ritz-Carlton of health experiences I've ever had. It's fantastic.
Awesome.
Like now it's to the point where we walk in, we all hug. You know what I mean? Like, it's truly an amazing group of people.
And I think that has to complement the medical experiences, also the team and delivering it. And I understand, like, you have access to a lot of opportunities, but that you selected Rehealth as your place, means a lot. So we're glad you trusted us with your health journey.
And I tell everybody I know that has problems. I brought a friend of mine. He's coming back his second time tomorrow. He had Mr. On.
Yes.
This guy had 15 years of chronic back pain, 15 years. And he owns a restaurant. And I saw him one night and he was leaning over the table and I was like, what's going on? He goes, I got to have back surgery and my back's been killing me. I go, wait, I'm going to this place in Cancun. Let me bring you with me. I brought him here. He got injections in his back. He got an infusion. That night was pretty rough for him. The next day, this guy woke up and was dancing around like a 15-year-old. It's been a year. And he's been the same ever since.
That's awesome.
Like I get goosebumps when I think about this guy. He travels to Korea every year. For the last 5 years, he couldn't go to Korea because his back hurt so bad. He spent a month in Korea a few months ago after the treatment. He was in Costa Rica. He's been vacationing. He's been living his life at its fullest, and he doesn't want to stop. He sent his wife here. He's coming here with his best friend. Like, what you guys do is unbelievable. It truly is. I know another person. I feel like I'm doing all these testimonials. I know this other person, my friend Cindy. She had stuff going on in her lungs, and she was on the lung transplant list, not on the list anymore. You know what I mean?
That's pretty amazing. And you touched on a good point. I think each one of these patients you mentioned all had their own different issues, right?
Right.
And so here at Rehealth, we really want to emphasize and focus on personalizing precision medicine at its finest. So we have to understand two things, right? Not only what the patient's deficiencies are, but also what are their goals? What is he trying, or what are they trying to accomplish? And our medical team and our staff really try to address that and ultimately put together a treatment plan that does so. So you've heard 3 different potential, patients with different issues, all of them addressed because we've taken that. So we have 3 primary treatments that we focus on here. One, as you've heard, is the stem cell treatment, which are mesenchymal stem cells, and I'll let Dr. Gonzalez speak about that in a second. Second is our NK cell therapy, which we're extremely excited about. Our NKs, they're like the Navy SEALs of your white blood cells. So as we get older, they get older too, and they don't want to fight as hard. So what we do is we kind of strip the senescence, or the old age, from these cells. We reinfuse them into you. And from there, they're going to be at a younger state, obviously willing to fight. And on a recent publication that Dr. Gonzalez has put out, we've noticed that they've set back 2 of the primary anti-aging markers. So I think that we're just scratching the surface of what these cells can do on the anti-aging side. And finally are the exosomes, which are the microvesicles, or a stem cell byproduct that we use a lot for cosmetic and other reasons. So with that, I'll turn it over to Dr. Gonzalez and let him talk a little bit more about the science.
I think the neat part is probably, and you've seen this because you've been here several times, is the difference, for instance, maybe in your first treatment versus your second treatment, because we try to spend time, and each individual it has a different type of treatment regimen, whether it's a 1-day protocol, 2-day protocol, 3-day protocol. It just depends on the individual, and understanding that it's trying to be personalized to what the person has.
Right.
And then also going with setting expectations on each individual of, this is what I'm feeling, this is where I'm at, and what do you want to achieve? Where are you looking to get at? And can we achieve that is our primary focus here and what we want to do. So if we want to regulate the immune system, if we want to make your immune system overall better, so it can regulate and can modulate, take care of all the inflammation, everything, then we will focus on the particular cells, our umbilical cord mesenchymal stem cells. This is a cell that's not like the ones you hear of, ground up tissue, extracted from you from bone marrow, which that's like, it's crazy, because essentially, people talk about, I got, they took it out from my bone marrow.
Not the same.
But no, it's nowhere near the same, because it's essentially, if I tell you, let's go fishing for tuna in a pond that has nothing but barracuda, and there's 2 tuna in there of 1 million, or what are we fishing for?
Right. I love
so
that
that's
example.
that's exactly what what you get when you talk about bone marrow. And similarly, when you get fat, these are actually culture expanded. They're grown. It's a pure stem cell type.
Well, that's what I'm saying.
What it is.
It's like when I'm in the United States and I'm speaking to people about stem cells, they're like, oh yeah, I had that. No, you didn't. No, right? It's different.
It's different.
And
they don't understand.
There's different levels. Like, not all stem cells were created equal. And I think that we've done a good job at creating a differentiation because we've been in the space for 20 years.
Like you can't get this in the United States. That's what I'm saying. Like,
because
and Cancun is a quick flight versus all these other places. And this clinic is fantastic. And this staff, I back you guys up 100%.
Awesome.
Thank you. By the way, another side note to something that. So I'm trying to do everything I can to be healthy on the inside, right? I want to be around for my kids, right, as much as I can. But as a byproduct of everything, is you tend to turn out to be younger. I get all these people complimenting me on my skin all the time, right? When I tell them how old I am, they're like, "What?" And my wife started coming here. She's had her second treatment. She looks amazing. Her skin texture, she's got the body of a 25-year-old, right? I mean, she just looks amazing. She goes out with her friends for reunions, and when they take a group photo, you're like, she's
the young one.
She's the MILF. You know what I mean? I mean, it's unbelievable.
Hey, you do notice skin quality improve, hair quality.
100%.
You'll start to notice your nails grow out faster.
My nails grow. I gotta cut my nails almost every day.
I'm racing my 2-year-old that still has to cut his nails faster.
It's crazy, man, but it's such a fun ride to see. You don't know what's coming. You know what? Oh, this. I wake up and I sometimes feel like I'm just operating at a higher level than anybody else. Does that make sense?
100%.
Like, it's crazy. 100%. It's like so I'm 55 years old. I feel here and in here that I'm 25 years old. You know what I mean? Like it's mind blowing. It's literally mind blowing, man.
You're on the other side of your first treatment. It completely changes your perspective. I mean, you have to have gone through this. And I think that's where it's important for people to do their homework because, like you said, everyone hears about the buzzword stem cells, right? There's been a rush of clinics and places getting into the space because it's lucrative and it's really one of the places where medicine needs to go. But you have to understand the importance of the work that is done on these cell lines, that the cell lines have been tested for, all the viruses. It's free and clear of those. We've also done the genetic karyotyping to ensure that there's no genetic aberrations on these, so that safety is first, efficacy is second, and in our case we have both.
And it's also the way we grow them up, because we have a specific formula of how do we grow them up, specific diet that these things are on, that we've spent years optimizing, running through different formulas of what's the best formula to maintain these strong, naive, and as potent as possible. It's going with that. But on the other note of the thing that you talk about is the eating right, all that, because a lot of people will try to come. You'll have your typical, somebody has lung issues, pulmonary fibrosis, that'll say, oh, will this cure me? Will this make me better? This will help you, but if you don't help it, you're not going to get anywhere. You got to get on spot you got to get on the diet. You have to you got to quit smoking if you have pulmonary fibrosis and you're smoking. You got to help yourself, because if this is essentially an investment in your health, you have to take the other steps to help.
You're 100% right. And that's where a lot of people, I've been around people that I've sent here before, and they went and they had, I went into a party last night and I had wine and I had beer. I'm like, you can't do that. You can't. You gotta do it right, especially after the treatment. I don't know what the time frame is, 3 months or something.
Yeah, you wanna.
But from I'm just locked in. I'm in the zone.
And the other important thing is, as well, is you have to make sure that you clean remove any sources that are causing this. Because same thing, we could have a great treatment on you, but if you have, if you're intoxicated, if you're, inflamed, if you have gut issues, then the cells won't do, their job. That's where the diagnostics first, to understand, like I said, what your deficiencies are. Make sure we clean that up as much as possible, because if you're putting fertilizer into bad ground, it's going to be tough for something to grow anyways.
You're right.
So we like to clean the ground first.
You know what? Something that's, I mean, this is a very serious subject because it's our health, but it's also, from my point of view, it's fun. Mm-hmm. It's fun to see the growths, and it's fun to see what's changed in your life. And it's fun to work on inflammation. I'm getting rid of inflammation. Yep. It's fun to watch my blood work come back and be fantastic. I had the best blood work I've ever had in my entire life.
At 55.
At 55, yeah.
Right.
That's like, awesome. It's crazy, right? Fantastic. You guys, I'm so grateful for Rehealth. All you guys.
Awesome. Thank you.
So Johnjay, it's really a pleasure. I mean, I know you've had a ton of success in what you're doing, and really happy that you were able to make it down and that you've trusted us on this health journey, because that's really what it is. Because you could have picked anyone along the way. What one piece of advice would you leave for other people that have had similar issues, or just frustrated that they just can't find a solution that's healthy to get them to feel better?
I would say, and this is what a lot of my listeners message me and ask me questions, and I always repost their question. I tag Rehealth. I put the website on there. I'll tag Rafael, and I'll be like, call them and talk to them and tell them what you're going through. Because every person I've ever sent, Dr. Ortiz calls them back, Eduardo calls them back, Lucia calls them back, and they talk to them and walk them through and say, hey, they can help me. And what's great too is like, hey, they can help me. This is something like, it's not like a money grab. Right. It's like, sorry, this isn't going to work. Rafael, I mean, so many times I'll be like, hey, I got a buddy who has this. He's like, man, we can't do anything. You know what I mean?
Setting the expectations very big.
Right, yeah. Right. It's like being honest. It's like honest medicine. That's what I love, the integrity here and the character here. So I would say call Rehealth and talk to somebody, and you'll get the answers you need.
Excellent. Yeah. Well, thanks again. It was great seeing you.
Yeah, man.
Hope to see you back.
It was great, dog.
Awesome. Thanks so much.
Thank you. Thank you.
Thanks, Johnjay.
Yeah.
So thank you everyone for joining us today with Johnjay. Please make sure if you have any questions, you want to go ahead and book an appointment, please click on our link below, and we look forward to speaking to you.